if it's done in the right hands, it's done well, done by the appropriate provider, it looks fantastic. And actually, you really can't tell anything's been done.
Hey everyone, I'm Claudia and this is Social Questions by Top Choice Awards. Today we're here with Dr. Thomas Nakatsui, cosmetic dermatologist at Nakatsui Dermasurgery Center, Edmonton's top choice cosmetic clinic of 2025. We're so happy to see you on the show again.
Thank you for having me.
What do you believe is the biggest misconception about cosmetic dermatology that you wish more people understood?
I think that the biggest misconception is that that if you have cosmetic surgery, that you will look unusual or will look distorted. And I think that if it's done in the right hands, it's done well, done by the appropriate provider, it looks fantastic. And actually, you really can't tell anything's been done. And so I had a patient today, for example, that spends half her season in down south in Scottsdale, and she said she refuses to have anything done there because all people there are just have too much done to them. But if it's done right, you look completely natural. There's really nothing abnormal. It looks completely refreshed, rejuvenated, but completely natural.
Yeah, I can understand because I was just in Scottsdale and I feel like people are all starting to look the same.
Exactly. You have to be careful who you go to, but definitely in the right hands, it looks completely natural.
With social media filters and AI-generated faces becoming more common, have you noticed a shift in the kind of procedures people are requesting?
I don't know if I've noticed it from the AI part of view. Certainly from COVID and people having to be on, all these virtual meetings, people now were able to see themselves as others see them. And so that definitely generated a huge increase in number of patients who want to get things done. Because most of us don't look at each other, look at ourselves in the mirror all the time. And so when they're on the Zoom meetings, though, now they know exactly what they look like. And that did cause an increase. But AI, I don't think has really made a change so far that I've noticed.
Yes, those selfie cameras I find are just not too forgiving sometimes.
That's true. That's true, too. That's a very unforgiving photo.
Yes. Have you seen any emerging trends in male cosmetic procedures? Are like men more open to cosmetic enhancements now that they were maybe 5 to 10 years ago?
I think men are definitely more open to it. We definitely see more men that are coming in for Botox, for example, for treatments that rejuvenate the skin, that produce more collagen and refresh the skin. It definitely has become more acceptable, although there's still a bit of stigma in the sense that a lot of men don't like to share to others that they've had it done. Whereas with women, they're far more likely to share, oh, I had this done here, you should go here. Men just kind of keep a tight lip and they're just happy that no one knows. I actually have a patient yesterday who came in and he said that he had some Botox he's been having it done with me. And he was with his sister and somebody asked the sister, is this your younger brother? When actually he was the older brother. And no, he never said anything, but he's been getting Botox.
He's probably like, oh, I'm just, doubling up on vitamins.
Yeah. The sister is now getting Botox, by the way, just so you know.
Because of him.
Yeah. Now that he's
Nice.
the younger brother, even though he's supposed to be the older brother.
Yeah, and he's the walking billboard for you, so it works. You work with such a wide range of clients. How do you personalize treatments to suit different ages, ethnicities, and skin types?
That's a good question. It's something where we have to take every patient individually. And we have to look at them and look at their age, ethnicity, their different factors about them, how their facial structure is. And we have to individualize every treatment for every patient. There's no two patients that are exactly alike. So it is something where we can't just say, this type of ethnicity, we have to do this. Although there is a tendency, but every individual is different. And so we have to come up with a plan that's very specific for that particular person at that time in their life, because as they age, things change too. We lose volume in our face, we lose fat, bony mass, we lose collagen. Things change all the time and we have to adapt and change and for these patients.
What core value drives every interaction at your clinic, from the front desk to the procedure room?
I think the core value that drives our clinic is our need or our desire to make the patient happy. We really want our patients to be happy with the treatments that they get, with the service that they get. We can never be perfect all the time. We can't always answer the phone perfectly every time, but we try our best and we really strive to do the best that we can. And I think that everyone in this clinic is really dedicated to that.
Thank you so much and congrats once again. What would you like to say to your Top Choice Award voters?
I just want to say thank you to all of those voters. Thank you from myself, from all of my staff. We really appreciate the trust that you've placed in us. We appreciate that you feel that we provide excellent service and excellent results. But we really, really thank you for your effort. We really appreciate it.
Thank you again. And this has been another episode of Social Questions.
Thank you.